So here's some good news. This is an MRI-guided focused ultrasound system. Researchers at the Sunnybrook Research Institute in Toronto are using a system like this to remove amyloid plaque in the brain, which is one of the proteins that's a hallmark of Alzheimer's, using sound waves. The system works by focusing low-frequency sound waves through the patient's skull to open up the blood-brain barrier that normally protects the brain in very specific areas associated with recall. Opening up the barrier that way allows the brain's own, essentially, cleanup cells more access to those areas, and early studies have shown measurable reduction in amyloid plaque in those areas. And again, it does this with no surgery. It's just a patient lying in an MRI, and it can repeatedly target the same areas with millimeter level precision. What makes this process potentially even a bigger deal is that a recent study showed that when using this focused ultrasound technique along with an antibody delivered even better results, which means that it could assist in improving drug delivery across the blood-brain barrier in general. That's huge because it's been that limitation that's prevented more effective treatments for a whole host of conditions like Parkinson's disease, brain tumors, ALS and Huntington's, and even some psychiatric disorders and depression. It's not just conjecture either. There have been clinical trials already with early positive results for controlling tremors in Parkinson's and epilepsy. That's very good news.